African countries begin to reopen from lockdowns imposed by the coronavirus, questions remain about how to keep ourselves healthy, what to do about wearing masks, and when there might be a vaccine or other treatments. Hello, and welcome to this special edition of Our Voices. I am Oriane Itangishaka. During this coronavirus pandemic, Voice of America has held numerous virtual town halls with healthcare professionals answering your questions in English, French, Swahili, and Hausa. Today, we'll bring you some of those voices talking about the virus. Joining me are my co-hosts, Haiti Adams Fitzpatrick and Ayan Bior.
Thank you, Oriane. We're going to hear today from Guinean doctor Sona Konate about when a coronavirus vaccine might be available. And a little later on, we'll also hear from Kenyan doctor Mercy Korir about who is most vulnerable and what you can do to best protect yourself.
We'll also hear from Nigerian obstetrician Myro Mandara about pregnancy and the coronavirus. And we hear from a pregnant mom in Dar es Salaam about how her family is dealing with the outbreak.
Thank you, Haiti and Ayan. And for you viewers at home, you can join the conversation on our social media platforms. Our handle is at VOA Our Voices. And that's our WhatsApp number right there on your screen. Tell us about how this pandemic is affecting your life and what kind of information and stories you would like to hear more of. Now, Dr. Sion Faro is a special advisor to Ethiopia's Ministry of Health. During this outbreak, the emergency medicine specialist has been working at the New York Presbyterian Hospital. Here's what her day has been like.
The amount of stress, the amount of constraint that has put on the system is beyond what I could explain. When I walk into my emergency department, before I walk into the emergency department, it's like the streets have changed into an emergency room. We have a tent outside taking care of the mild symptoms. And when you walk into the waiting room, which any other time would have been a waiting room, is now an emergency room where you see patients coughing, complaints of fever and headache. And our emergency rooms now feel like ICUs, because when you walk into the emergency department, you see a lot of patients on a ventilator because they're unable to breathe on their own, or they are in severe respiratory distress from this. So it's almost stretchers and on the hallway and shoulder to shoulder with lots of patients, lots of people, providers. We have not allowed family members to be in the hospitals during this peak season here, and we're witnessing unprecedented amount of death, meaning our morgues are full. So now we have to put bodies inside a refrigerated truck. And this is the case in almost every hospital. And the sad thing is the governor announced yesterday that we're running out of burial spaces, that would have to start using park spaces for burials. So as a person who practices in a high-income country and also knows the issues in most of the sub-Saharan Africa, I never thought I would witness things like this in the U.S., where we presume to have lots of resources and also the right amount of human resources as well. So it's just been mind-blowing to witness this in this country, and to have shortages of supplies and to continue to have now shortages of medicine.
Now, Dr. Faro says that the virus does not discriminate, so people in Africa must focus on the prevention.
People are not taking us seriously, thinking that this is a disease of the rich or as a disease of the white or the Westerns. I really do hope that we have a shift in how we think in Africa. This is the window of opportunity we have. Knowing the lack of resources in Africa, prevention is the best strategy and the most effective strategy that we have. So it's very important that people do listen to the advices of their officials. Just like the saying goes, an ounce of prevention is worth a pound of a cure. And the most effective thing that we have for Africa right now is prevention, and to make sure that we don't have the spread of the disease like we do in New York and in Europe, because we don't have the system, and also our health system is not going to be able to withstand this amount of people and people dying. So when it comes to the idea of this flattening the curve, let's not even get to that level. When we're still very plateau and with the low cases that we have, we should definitely keep it at that and prevent the spread of the disease, because when it spreads like a wildfire.
Les dégâts sont énormes.
The damage is tremendous, and it has a domino effect.
Voyez-vous, je suis restauratrice.
You see, I am a restaurant owner. I employ people, and these people rely on the income that comes from my restaurant.
Donc du coup, sans compter quand je parle de chaîne.
So suddenly it all stopped. Everything related to it too. The purchases, the contacts, the deliveries. It's like a chain. It all goes down too. It also has an impact there. So the damage is really huge.
Les dégâts sont énormes.
I can say without exaggerating that it created a sense of misery. We have not received any help from the government. I wonder if we ever will. During their decision-making, they did not take us into consideration. If they want to help, they need to be organized. And we weren't even considered, although we pay our taxes. On what basis will they compensate or help? So no, I have not been compensated, and I will not be compensated.
Je n'ai pas été dédommagée et je ne serai pas dédommagée.
In the transportation sector, contamination happens very, very, very fast. They let them work while taking precautionary measures. But they did not do so for catering. Catering is necessary. They could have organized us as well. Asked us, for example, to distance clients a meter apart. We also shouldn't limit ourselves to ways to stop the pandemic. What about afterward? If I open tomorrow, I will insist that my clients wash their hands when they enter and when they leave the restaurant. So that's how the pandemic affected us. The future rests in God's grace.
Is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
You're with Our Voices. Welcome back. Now, VOA's Swahili news team recently co-produced a virtual town hall with our partners at the Kenyan television network. And on that show, Dr. Mercy Korir answered a question from Kimberly Whitney in Mombasa.
There are people who don't show signs or symptoms of the coronavirus, but they test positive, and there are others who show signs. But it turned out to be the other diseases like flu or normal fever. So what is that causes people to test positive, but they have no symptoms?
According to the statistics that we have seen around the world, in Africa and Kenya, large percentages of people, around 80%, will show no symptoms at all, or they will show mild symptoms. And among the 20% remaining, we will have 5% that are critical and need critical care. Many people will not advance to critical condition with this virus. Symptoms that we know and what people have been told about this virus is high fever, dry coughing, and people who have got this disease are saying when they cough, it's like they are coughing from their lungs and have trouble breathing. And when someone fails to breathe properly, then it means their condition is critical. So, because many people will not have symptoms, the best way to know is to have them tested.
Now, many of us are wearing a mask when we go out in public these days. From the KTN studios in Nairobi, Dr. Karir explained what you should look for in a mask and how you should use it.
Wakenya waweze kutumia. Na serikali ya Kenya ilipatia watu
Let me give you an example of the masks the Kenyan government has told people to use. The Kenyan government gave people the option to use masks that are made from normal cloth. They were told that the mask needs to have 3 layers of cotton, and it needs to cover your nose and mouth properly. What I have seen in the streets of Nairobi is that these masks are better and cheap, and after wearing these masks, at the end of the day, a person needs to wash it with hot water and let it dry outside in fresh air. A person can buy 2 or 3 masks so they can change it frequently. With surgical or N95 masks, the government has said we should leave those for health professionals at the hospital who are helping corona patients because they are in high risk and they can get the virus easily.
Barakoa yoyote kwanza, iwe ni ya kitambaa ama iwe ni ya surgical mask ama N95.
Before using any type of mask, whether it's the clothing mask, surgical or N95, people need to wash their hands first. And we know you need to wash your hands with soap for 20 seconds or more. Wash your hands properly from thumbs to other fingers and wrist. Second, you need to put on your mask. You are not supposed to take out the masks when walking. When you walk in the streets, you see people have masks on their chin and other places. This is not good because if the virus got into the mask, then you can get them easily.
In Niger, student Shamsia Mahamane Sani had a question about Africa's response to the virus. She got some answers from epidemiologist Dr. Sona Konate.
Apparition de l'infection en Chine en 2019.
Since the onset of the infection in China in 2019, Africa did not start recording its first cases until February 2020. And since then, the figures have been explosive. So I wonder whether African countries have not really underestimated the appearance of the infection here in Africa.
Absolument. Et donc, c'est le seul moment où personne ne doit avoir peur de dire.
This is the only time when no one should be afraid to say, I don't know. I'm not sure. It's not ignorance, but it's cautiousness. It's because nobody knows. Nobody knows. The greatest scientists on the planet are looking for answers to this. And that's the beauty of it. It is that the citizens, the ordinary citizens, the eminent doctors, the eminent professors, the eminent laboratories, all are fighting for the same reason, to understand what this horrible virus is all about. What is its behavior? What is really the way to prevent another wave of such a pandemic?
In Burkina Faso, student Muriel Kielem wants to know about a vaccine. Dr. Konate says it will take a while.
Currently, my main concern relates to the implementation of a vaccine to fight against this pandemic. We noticed that with certain diseases, we had to develop vaccines as a preventive measure with the antibodies of people already cured of the disease. Why don't we do the same with a vaccine to prevent a pandemic?
Voilà, il faut savoir que pour développer un vaccin, c'est pas si simple que ça.
You should know that to develop a vaccine is not that simple. It takes time. First, the vaccine must be made. It must first be tested on animals. It must be tested on humans. It must be evaluated. We must see the clinical effect and the physical effect. After that, there is a whole series of approvals by the medical and pharmaceutical authorities of the country. And after, the vaccine can be released if it is approved, that is to say, if it is safe for human health. Now, we can market it for human use. It is already a big step for the world pharmacologic community to set up a process to start the research for the vaccine. The first patients have received the first vaccines, and therefore, now we are waiting to see the effects. I know that when a vaccine is injected, there are blood samples that are taken periodically. That's it. It's to see the evolution of the immune response in the blood, how these patients are responding, and if this vaccine really can be used on a large scale and in a safe way on human beings. That's why it takes time. If within 14 to 18 months we have managed to obtain a vaccine already on the market, it will be a very great victory. So what I want to say is that it takes time. We understand the urgency. Everyone would like a vaccine, but we must also take into account the validity of the vaccines. Also the fact that this vaccine is not more harmful than useful.
We're going to take a short break here. Just a quick reminder that you can get the latest news about the coronavirus if you go to voanews.com. And you can also connect with the Our Voices team on social media. Our handle is @VOA Our Voices, and that is our WhatsApp number right there on your screen. We'll be right back.
I'm Amanda Bennett, and I'm director of Voice of America. I'm recording this from home because here at Voice of America, almost all of us are now working remotely in order to help slow the spread of the coronavirus.
Voice of America, upholding our mission.
We at the Voice of America are taking COVID-19 very seriously. And for that reason, we're bringing you Africa 54 live from Esther's house.
Today and every day, we're here for you. We improvise in tough times, but we report from our closets, from our laptops, from our homes, as we take care of our kids. Our homes are the new newsroom. We're all home together, but the news is still here. Voice of America, a voice for the world. Because a free press always matters.
Welcome back. You're with Our Voices. Throughout this pandemic, there will continue to be information and misinformation about drugs that might help prevent the virus or help ease the symptoms of people who have it. In Nigeria, Dr. Mairo Mandara told VOA Hausa about the dangers of untested treatments.
One thing with our people is as soon as they hear the doctor naming a drug, they rush to the chemist to buy it. We know these drugs, and there are 3 of them, which when administered on patients, help to bring down fever and prevent the patients from getting other illnesses. There are drugs which stop lung inflammation. There are others which help with breathing. But we as doctors don't like to name those drugs on television or radio because our people are in the habit of rushing to chemists to grab them. Just recently in Maiduguri, some people, after learning that the virus can get into the body through their mouths, went ahead to consume lemons excessively to the point that it cost them ulcers. That's the reason we don't want to name the drugs. What we encourage is taking preventive measures. And those of us who are not infected with the virus, we need to keep our lungs healthy, which means people should avoid sedentary lifestyles, where they sit on the chair from morning till evening. We advise people to do physical exercise to increase the rate and depth of their breathing. People who live in a house with a staircase should be walking up and down the steps. Do some domestic chores, such as splitting up firewood until they sweat a lot. This will open the air passages of their lungs.
Dr. Mandara is an obstetrician and gynecologist who has gotten many questions about the coronavirus and pregnancy.
Research is underway, but it has not been established yet that when a woman is pregnant, she has a higher chance of getting infected with the virus than a man. The majority of the deaths we have seen are those of old men. But when a pregnant woman contracts the virus, chances are that she will have more complications than others because the virus attacks the blood and pregnancy has so much to do with blood. But for now, there is no evidence indicating that pregnant women are more susceptible to the virus. But when they contract it, it may be more severe for them.
In Dar es Salaam, expectant mother Mary Mohava was delighted to learn that she would be welcoming a new child into the world. Then came the coronavirus, and then she lost her job. Here's her story.
Hiki kipindi kinanitisha sana.
I am terrified of the coronavirus pandemic. My biggest fear is that I don't know if my child will be safe when the time of delivering comes.
Na kitu kingine ambacho kinanipa wasiwasi mkubwa sana.
I have to use public transportation because I can't afford private transportation. And you never know who will sit nearby. You can't really tell if the person has COVID-19 just by looking.
Njia zipo nyingi sana ambazo zinanipa wasiwasi. Natamani hata sangeni.
Sometimes I even wish to quit clinic, but I can't. I have to track my child's health. I was at home when my boss texted and told me to stop working when we started hearing about COVID-19. Frankly, it was very difficult to hear the message.
Nilijaribu kujenga urafiki wanae karibu ili nijue ni kweli.
I tried to talk to her again to find out if I was fired because of COVID-19 or because of my pregnancy situation. I realized it was the coronavirus.
Hali iliyokuwa ikiendelea, hali ya corona. Kunachangia maisha yazidi kuwa magumu sana hasa kwa hii hali. Kwa sababu
life has become even harder since I stopped working, especially under the coronavirus. My husband and I are the only ones feeding the entire family. But we lost our jobs and we are staying at home now. We need to survive. My kids need to eat, and they don't understand when there is no food.
Hali ambayo ni ngumu kiukweli, na hali ngumu sana. Save pesa kwa sababu pesa tulizokuwa tumezisave.
Since our savings is running out, we had to change the whole system of food. We are now cooking half of what we're eating, so we can sustain ourselves during the hard time, as we don't know when the pandemic will end.
Hatujui hili janga litaisha lini. Napenda sana kufanya kazi.
I have always loved working and I really miss my job. My job has a huge contribution to my family, my life, and during my pregnancy, without it, we can't survive.
Kuendesha maisha yangu mimi pamoja na familia yangu. Kwa ni kitu ambacho kinanipa wasiwasi sana.
We still need to figure out how we're going to survive, how we are going to sustain, and how to bring income with this year to keep the family and take care of the newborn.
Baada ya watoto wangu kusimamishwa
After all, schools were closed due to the coronavirus. My brother-in-law created a schoolwork schedule for the kids.
Alipanga ratiba kwa ajili ya watoto.
They have time to study, to pray, to watch TV and cartoons, and we make sure to review their schoolwork.
Vipindi vya watoto, na kuna muda pia ambao tunakaa nao kwa ajili ya kuongea nao mawili matatu, kujifunza. Kuna kipindi labda nikiwa nimeshiba, nimekaa nimetulia.
Every time after I finish eating, my kids like to play with my baby bump.
Wenyewe wamekuwa yani kwao imekuwa ni faraja. Sasa ni muda wote utakuta wako.
They like it when they see baby kicking. They wish to see their younger brother soon.
Sijutii kuwa na hali kama hii, wala sijutii chochote. Kikubwa ninamwomba Mungu.
I don't know what tomorrow holds. I don't know when this situation will end.
Kutokana na hali yenyewe sijui inaisha lini.
I'm still thinking of my tomorrow. I wish it could end now so I can get back to hustle, so we can all get back to normal life.
Ili tuweze kuzisaidia familia zetu.
And that's where we'll end it this week. I would like to thank my co-host, Haiti Adams Fitzpatrick and Ayan Dior. And I would like to thank our colleagues in VOA's Hausa, Swahili, French, and English service for sharing with us in this virtual town hall meetings that they've had. From all of us to you, I thank you, and I thank you for watching our voices. Until next time, stay safe, stay well, and good day.